This is one of Iowa's health challenges. A decade ago, the CDC reported that 29% of Iowa adults were considered obese. In 2019, that had jumped 5% up to 34%. And then last year, as COVID-19 was hitting, that rate increased even more, up to 36.5%. That meant the nonprofit Iowa's Healthiest State Initiative has more work to do. The group's leader expected the disappointing news, though.
Well, I wasn't surprised, I guess. It's always disheartening when you see that, negative numbers coming out for the state of Iowa, but also wasn't surprised when you think about what's happened the last 18, 19 months in our state.
When COVID started, we wondered what would happen here, because at the beginning you saw all kinds of neighbors out there walking. You couldn't find a bike because they were sold out all over the place, and you wondered, is this going to be some kind of health revolution where we all get Peloton, somehow afford that, and everybody's going to be in great shape. And it does seem like maybe we've done the extremes here. You have some people who are in a lot better shape, but then we've seen the downside too.
Yeah, definitely. I mean, you just think about, for some of us, it was easier for us to now get out and do more walks. And I would say even in my own neighborhood, I saw more of my neighbors out walking than I had ever seen prior to COVID hitting. But we also know there were a lot of people in our population who didn't have the same flexibility even in their work schedule. If you think of essential workers, they were actually working probably more hours and potentially even under even more stress than the rest of us. So they didn't have that same opportunity to maybe get out and buy a new bike or try to find a new bike or even just get out on the trails as much as others. So it wasn't equal across, the population by any means when it came to just that physical activity component.
And we know children, at least for a while, we had a lot of kids sitting in front of a computer screen for the bulk of the day. And now these numbers show that may have been one of the factors why that number went in the wrong direction.
Yeah, definitely. A lot of our kids didn't have the same access to physical activity, to healthy eating as they do when they're in the school setting. And so we saw nationally, a number of our kids were having to learn from home during that time, and that meant sitting behind a computer screen. And so they didn't have that ability to get up and move around and have recess and have physical education and just even walking or biking to school. When you think about, how you naturally have incorporated some physical activity into your everyday life. I'd say that even the same for myself, parking in a parking ramp and walking to the office. You lost that because now you're just walking from your bedroom to another room in your house even, and it's a lot less physical activity that you're getting than when you were probably at the office having to walk from different spots.
Here's one other thing that came up here. Apparently Iowa is more of a meat and potato state here. When it comes to eating fruits and veggies, Iowa adults are not very good. 33rd nationally in the per person consumption of fruit and vegetables, according to America's Health Rankings. Next to the Insider's Quick Six, what's the difference between a Democrat serving as Attorney General and a Republican?